T-E-R-B-U-F-O-S, Tebufos. All the 6 children died of Tebufos ingestion. In the past weeks, several chemicals were bandied around as possible causes of death. Some were even found in some retailers. In order to avoid confusion, ladies and gentlemen, I wish to mention each one of these chemicals and explain their significance. But before I do that, I need to explain that apart from organophosphate, another group of chemicals used as pesticides are called carbamates. There's a slight difference between carbamates and organophosphate. As I said, they are both used as pesticides. But one major difference is that organophosphate is much more lethal and can cause irreversible damage. Sometimes last week, there was a statement that indicated carbamates as the cause of death. This was from post-mortem observations, just observations. But toxicology has proven that the actual cause of death is organophosphate and not carbamate, as it might have been initially thought. On Friday, the 25th of October, 2024, we had informed you that 4 people were arrested at the Johannesburg Mall because they were found trading in a chemical called Aldicap. 1,450 grams of this chemical was confiscated by police. Now, what led to the arrest of these 4 people was that during the operations in Naledi, some of the spaza shop owners confessed that these 4 are the people, these people in the mall, in the Johannesburg Mall, are the people who are selling them illegal chemicals. That's why part of the team went there, and in fact, they found this Aldicap. Aldicap falls in the class of, it's one of the carbamates. I've mentioned that we have got organophosphate and carbamates, and organophosphate were responsible for the death, but Aldicap was found being sold. It is a carbamate, as we have already stated. It is not the cause of death in these particular cases. If it has caused death before, we are not yet aware of that, but it wasn't. But still, it remains illegal to be sold to the public because it is also a dangerous substance. At the present moment, samples that were taken via swabs in the various spaza shops in Soweto have been sent to the National Health Laboratory Services, and we are still waiting for the results. This means that while organophosphate was found in the bodies of these children, we are still waiting to see if the organophosphate was also found in the spaza shops so that we can scientifically link the events. It is also important to mention that police did find a packet of chips in the pocket of one of the children who demised. This was also sent for analysis, and the results were out, and they were found to be negative. That means this substance, organophosphate, which killed the children, was not able to be detected on the packet of chips that was found in the pockets of one of the children. Now, let's try to analyze the present situation that we are faced with. When we mentioned that we are sending teams to search for signs of chemicals in these spaza shops, some people on social media were very skeptical because they reasoned, and I think as ordinary people it's understandable, they reasoned that if indeed there are chemicals in the spaza shops that affected and even killed some of these children, why would spaza shop owners not equally be affected? Because they should also be exposed to the same substance. It is very important to explain this. It is known medically that children are more susceptible to pesticide toxicity and other environmental toxicants than adults. This is due to several factors which are mostly physiological. The first one is body mass. Children have a smaller body mass than adults, and therefore a given dose of pesticides can have more severe impact on a child because of the smaller body size. Number two, developing organs. Children's organs are still developing, making them more vulnerable to the effects of pesticides because they are not able to handle them. Excuse me. Number three is the route of exposure. Children are affected by acute pesticide poisoning and chronic effects of exposure through ingestion, inhalation, and dermal contact. You're also aware of behavioral patterns of children. I'm sorry, before even coming to the root. The behavioral pattern of children is different from adults. We all know we have got children. One of their well-known behaviors is hand to mouth and hand to object. Adults don't usually do that. Children do that quite often whenever they've touched things, and this exposes them more than adults. And as I said, the route of exposure can be ingestion, inhalation, or dermal contact. That organophosphate can even enter your body through contact with your skin, and hence can affect you even from contaminated clothing. In other words, this organophosphate doesn't have to be in your mouth or inhalation to affect you. It can even go directly through your skin if you are in contact with it. So which means contaminated clothing can also affect people. But it has been reported by the World Health Organization that in children, the most commonest route is ingestion of this organophosphate. Now, I think it's important now that we have identified the agent to help even our health professionals, because it does not necessarily mean all of them, especially in rural clinics, EMS staff, etc. It doesn't mean they understand this. So we wish to advise them and the medical personnel in hospitals and clinics as follows. Signs and symptoms of organophosphate toxicity: severe diarrhea, vomiting, foaming at the mouth, nose, tears flowing very readily from the eyes without a person crying, and constant urination. Now, if you listen to these signs and symptoms, it's water, through diarrhea, through vomiting, foaming at the mouth, at the nose, tears, urine. But there's another area where this water is flowing, and that's where the cause of death usually occurs, in the lungs. Water literally leaks in the lungs and into the alveoli, and they block them. That's why it was reported that some of these kids turned purple before they died. When you turn purple, it means you are not getting enough oxygen, because the purple color is a mixture of hemoglobin and oxygen. And carbon dioxide. The purple color, let me repeat, because it might appear in the press that the minister said this. Let me repeat, the purple color for a person who is dying is a mixture of hemoglobin and carbon dioxide. When hemoglobin, which carries oxygen, when it has got enough oxygen, you look pink. Once you turn color to purple, it means oxygen is not entering your lungs, and that's what happened to some of these kids, because there was water in their lungs. Now, we are advising health workers that apart from supportive treatment, which they must give, we wish to advise that the antidote of organophosphate and carbamate is intravenous atropine injection. We also wish to advise, and this advice we got from the NICD, Dr. Mayet will have to expand further because it's important. We used to advise that when health workers are faced with this possible organophosphate poisoning, doctors need to use aflatoxin. This is an app designed by the Poisoning Center, which advises them step by step on what to do. Thank you very much. Doctor, maybe before questioning and anything, can you explain this app while everybody is still listening?
Thank you, Minister.
Come this way. No, she must come this way. I'll give her away. I want every word she says to be captured.
Thank you, Minister. So I think it's important that clinicians, healthcare workers are aware that a high index of clinical suspicion when a child arrives, that this could be a poisoning, to examine the child, look for the signs and symptoms, take a good medical history, and then utilize an app as the tool to determine what are the possible exposures, and to make a determination of what it could be and to treat appropriately. As Minister has indicated, atropine is the preferred choice, intravenous atropine, but the correct doses need to be administered at the correct time together with supportive management of the patient. That includes the dripping of the patient, oxygen support, and all the other necessary medical support required to sustain the life of the child. Thank you, Minister.
The app. Oh, you're talking about the app.
Yeah, no,
Okay.
gentle.
Okay, thank you.
Thanks.
There you are. I'm not the only one who's going to answer questions. I've got the whole team here. Ministers, deputy ministers, police commissioners. Yeah, thank you.
Thank you, Honorable Minister. Maybe before you take questions, let me check if other ministers do not make the input before we take the questions. Minister of Police, Minister of Small Business, okay. Any objection? Okay. Yeah, now we are going to take the questions. We'll have at least 2 rounds of the questions in order to ensure that we respond to all your questions. And if you feel that your question is being raised by one of your colleagues, you must just send that question instead of repeating the same question. So on that note, I'm going to now take the hands from strictly members of the media, because not everybody is the media. We will start here. You introduce yourself and your media house you come from. So number 1, number 2, number 3, number 4, also. And at the back, number 6, number 7. Okay, let's see if we've got more hands. So far we've got 4. Number 8. So we are going to take at least time to summarize your questions, at least the maximum of 2 questions. But it's not a must that you must ask 2 questions. You can try to summarize your questions. So in that order, I'm going to, there's a roving mic that is going to move off. Yeah, so yeah, try to be as brief as possible to allow other colleagues to raise the questions. So the ministers and all the panelists here will take all the questions. Over to you.
Good morning, Christina from SABC TV News. I'm going to clarify from the Minister that the substance that caused the death was not found in the spaza shops that were searched, but was carbamide found in the spaza shops when they were searched and when these officials did go in. And we know that organophosphate was not found in the pocket of chips that was found in the child's pocket, but was there any other contaminant that was found in there? And can you just tell us what household items or what items can the organophosphate be found in?
Thank you. Sweet and short. Number 2, I said to side.
Good morning, Katel Sohoto from Kaya 959. I'd just like to find out the status of the 4 people who were arrested, what happened to them, And are they still facing charges? And then in terms of the chemical of organophosphate, is there a specific product, or is there a name that it's found? So like you'll have a bottle with that name.
Same question.
Okay. That's it.
Thank you very much. I said number 3.
Good morning, everyone. My name is Yoliswa from Health E-News. I just want to take the department back to last year. We still have families that are still waiting for a post-mortem. Can you please get a feedback on that?
Thank you. The next.
Thank you. Komuza Mudisia from Eyewitness News. Minister, just to develop on my colleague's question around the organophosphates themselves, can you just clarify under what environment they thrive in? Is this a storage thing? Do they come up where things are stored? Do they come up where things are produced? I heard you speaking about agriculture. Where does it emanate from? And do we know where it could have started? And then secondly, around the people that were arrested, you said that it was the people that confessed, the shop owners that confessed, that there was an illegal chemical which was bought at the mall. Do we know under what circumstances that they are buying these illegal substances? Are they buying them and being forced to put them in things? Are they buying them and keeping them with them in the shops? And have they been charged? What exactly are they charged for, the 4 people? What charges are they facing? Yeah, thank you.
Thank you. You can give it to her here. Yes, next one. Yeah.
Hi, Bernadette Wicks, News 24. So I have 2 questions. The first being, if spaza shop owners are found to have negligently or recklessly been using this organophosphate, which I understand in of itself is not illegal, are there any criminal charges that could potentially follow from that? And then, yeah, I think that's all for now. I did have something else, but I think it'll come back to me.
The second one, it disappeared.
Thank you very much.
Sorry, my second question was, when it comes to treatment of children who have ingested, inhaled, or absorbed this organophosphate, can you speak to us about sort of what the survival rates are like, what the survival rates are like if treatment is secured early on, and how early on that treatment should ideally be provided in order to get best chances of success?
Thank you. Oh, wonderful. Your questions has been asked by colleagues. Any last question before we move? Okay, wonderful. Now I'm going to hand over to members of the panel.
You said 8, but there are only 6. Did I miss 8?
As I indicated at the beginning, if they feel that their questions has been posed by their colleagues, there is no need for them to repeat themselves.
Okay. Yeah. Maybe let me allow Minister Mchunu, he wants to deal with the charges. What are we charging people with who have been arrested? They are in his custody. No, sit here.
No. I'll take the mic.
Sit here. These people want to hear you. And I want the country out there to hear you, Minister.
Now, may I inform you that this is Dr. Aaron Motsoaledi. Thank you very much, colleagues. Just 2 points, and then I'll then ask the police to respond directly. Before last night and before we came here, we had a conversation amongst ourselves that even before we come here for this press briefing, it would be proper and it would be respectable that we properly inform the families that are affected in this conversation about the outcome that Minister Motsoaledi has just reported elaborately on. This we did out of respect of the families. We know they are grieving. We know it is painful. And I did speak to General Mtombeni after meeting families about their reaction indeed, like in all circumstances involving death, it was quite a somber situation in the morning. But however, we had to proceed, and we are here. And in relation to the 4 charges, 2 journalists have asked the same question. What are the charges? Mkhwete, or Provincial Commissioner, Lieutenant General Tumbe, you want to come here as per instruction?
I'll adjust the instruction, Minister.
You have to.
I told you.
Sorry. Thank you, Minister. Thank you very much, the 2 ministers present here, the Deputy Minister and Dr. Natal, which we frequently speak, and even yesterday night after our meeting. I think I have to respond on the 4 people who were arrested, rightful so, said by the Minister of Health that we had integrated operation. This operation included the Department of Agriculture, Fisheries and Forestry, Environmental Health, the National Institute for Communicable Disease, the Border Management, Gauteng Department of Health, and Law Enforcement on Thursday. We were, of course, in Naledi, and the chemicals were found, and then we were led to a mall in Johannesburg, as the Minister rightfully indicated. So, in that mall, we found 4 individuals who were subsequently arrested. The question is, what for? The suspects were arrested and charged for selling, amongst other things, fertilizer, farm feed, agriculture remedy, stock remedy, not registered. We subsequently took them to Johannesburg Central Police Station. We charged them under those act as directed by Department of Agriculture, Forestry and Fisheries, and as an integrated team, we were also advised by the department that these suspects could be released. On warning, we released them on J534. They ultimately paid 2,000 rand admission of guilty. The reason is that the suspects be released as they are not the manufacturers for those chemicals. I should think, ministers, that's what I'm supposed to be responding. Thank you.
Thank you very much. Yes, the first question from SABC, you say carbamide was found in the spaza shops. No, the swabs from the spaza shops were still waiting for the results. They've been sent to the National Health Laboratory Services. The result we got was from the toxicology laboratories. They are different. Toxicology laboratories are only 4 in the country, in Johannesburg, Pretoria, Cape Town, and Durban. And they are the ones who released this report about poisoning because that's their work. But for the swabs that were taken in the spaza shops, they were sent to National Health Laboratory Services. We are still waiting. There are 2 questions here about this issue of organophosphate. As I said, they are pesticides and they are used widely in agriculture. I want to emphasize Organophosphate are not supposed to be used routinely in domestic settings. I want to emphasize that. Part of the reason why people were arrested selling them, organophosphate are not just supposed to be found among people in domestic settings. They are supposed to be utilized in specific settings away from people, and I think the Department of Agriculture will come and explain this. The little knowledge I have is that to use an organophosphate, you need a special certificate from the Department of Agriculture because of the dangers that it poses. So when you ask me in what items is it found in the house, it's not supposed to. It's not a domestic poison. Maybe let me also explain this fact medically. I'm not sure whether it's law or just a practice, but when I grew up in medicine, one of the things I learned is that it is designed that any poison you use to kill pests or whatever domestically is not supposed to kill human beings. That is the golden rule, because you can't put a poison in a house when you know that it can kill human beings and we have got children, because I've defined the behavior of children, hand to mouth and hand to object. So for that reason, people who manufacture domestic poisons are by law instructed to make them weak. For instance, these pesticides are usually used to kill rodents. Rodents domestically are killed by Ratex. People don't like it because Ratex is weak. And it has been made to be weak so that it doesn't kill anybody. Any person who has seen a piece of Ratex, it may look like sweets or yes, to children. When I was still running my practice, I used to have mothers coming crying and carrying a piece of Ratex and say the child has ingested this. And I tell them, no, relax, nothing is going to happen. Because a child has to ingest a lot of Ratex for them to be affected, because it's a domestic poison. Not so with organophosphate. That's why they mustn't be found among people readily without any care, especially a certificate given by the Department of Agriculture. I'm going to try and make them explain that. The issue of what happened to the 4 people arrested has been done. It does not mean they are not guilty. They are selling a substance to people which is not supposed to be there. I got fearful when I heard that some of these organophosphates are also sold at old age payout points for killing pests. That's very dangerous and scary, and we're still going to look into that very carefully. Yoliswa, you said people are still waiting for postmortems. I'm not aware of that. And please give us the details. We'll check with the relevant people who are supposed to do such postmortems. I'm hearing this for the first time. The Khomotso, you also asked the same question: where is organophosphate found? It is not supposed to be found ordinarily in domestic substances. I know sometimes they mix it in paint and all that, but I want you to understand it. Organophosphate is not a substance that must really be used domestically. Now, why are spaza shops buying it? Our theory is, until we are proven otherwise, is that they are using it as pesticides to kill rats, specifically because I want to believe that there are rats in quite a number of spaza shops, since communities, it's also been sold to communities for killing rats, whereby they are not preferring Ratex. So we believe it came into spaza shop in that manner, but as I'm saying, we still have to prove scientifically its presence there. Benedict from E-News, whether if spaza shop owners are found, they will be charged. If once we make a link, yes. If we are able to make this link by saying we found this organophosphate in the stomachs of diseased children, and we also trace it to a spaza shop, it's found in your shop, and we know they did buy in that shop, that's a link. We are still making that link. Now, the issue of survival rates, Dr. Mayat, I don't know whether, because I know that survival rates in any form of poisoning depend, number one, how soon do you reach a health institution, and how soon is an antidote administered, and how soon is supportive treatment also administered. But I would like to give to Dr. Mayat.
Thanks, Minister. It also depends on the dose. You get acute poisoning and you get chronic poisoning. So acute is over a short period of time, immediate ingestion, long-term, chronic, long-term slow dose exposure, and also in acute situation, how much you consume. If you consume a very little or a lot. So I think the end organ damage to organs also will depend on the mortality related to that. Thanks.
You know, I want to give you a story just to understand how easy is it for people to be affected by organophosphate. I've got a younger brother. He's a professor now of dermatology in Sefako Makhato. At the time I entered Parliament, he took over my practice, and so he used to work in one of the rural hospitals doing sessions there. He arrived there one day to find half a village on the ground in the hospital, vomiting, foaming at the mouth, diarrhea, everything. Nurses were already treating for cholera. Because he was experienced, he detected the smell of organophosphate, and he rushed to theater to get organophosphate. To get atropine, and started treating them. The question is, how did that half the village got in contact with organophosphate? So he went to investigate. In that village, it's next to a hospital called St. Rita's. He found that there's a Makarapa there. Makarapa are migrant laborers, as you know, who's working here in Johannesburg, who came with a truck full of empty drums, water drums. People in rural areas like storing rainwater in drums. And he saw them, and that whole village bought them. Those drums were carrying organophosphate in agriculture. And the whole village nearly perished just because of that. So I just want to explain that there are very methods which inadvertently may actually kill people. If he didn't arrive in hospital on time, they were all gone because they were treating for cholera, and cholera was not involved. And there was no way, the poison was going to stop doing its work if there was no antidote. They have to rush to the neighboring hospitals there to get atropine, because we usually use it in theater. 2 weeks ago, I advised the Department of Health to start buying a lot of atropine in case, while we are still fighting this issue. Thank you very much.
Minister, you hinted that you may give colleagues from agriculture to clarify the issue of pesticides.
Organophosphate, how does, you have to come here. It's very important. We are summoning you to explain to the nation the licensing, how it's found and all that. How does it come amongst us? Yes.
Morning. The key to any product is a label. If a product doesn't have a label, remember now the label gives an instruction how to use a product. It guides it. There are also some precautionary measures that you need to take against a particular product. So organophosphate basically are meant to be used out in the field based on an issue related to pests that are more in crop production. Now, people remember now in terms of issue of them being categorized as hazardous products. At the end of the day is that there are restrictions, because based on also on the label itself, the label will indicate where to use it. If a label says to you, you can use it in production area, whether it's citrus or whatever, but why do you use it at the household level? Normally we got the so-called pest control operators who offer a service. They are registered under Act 36 of 1947, which is the same act that we are talking about, Fertilizer, Farm Feeds, Agricultural Remedy, and Stock Remedy Act. Those are the people who have been trained to make use of these particular products. Now, those restricted products, then they need to be handled by somebody who have been trained to utilize them. So the question was, how did it end up where it is today? It's still a mystery, and that's something that we are still investigating. I hope I've answered.
Licensing of anybody to use it.
Remember now, in terms of, like I indicated, in terms of a pest control operator, this person have to go on a particular training, then the department will issue a certificate to indicate that this person can be able to, for commercial purposes, be able to offer this service because he has been trained for that particular purpose.
Maybe when we settle, I've got 2 questions. Maybe just to also to clarify that this media briefing is live streamed, so people across the country, the other journalists who are following us. But I've got only 2 questions. That one is directed to SABC, one is directed to health. From Business Day, the journalist is Tamakan. Number 1, can you explain why NATJOINTS determined that the recent increase in reports of children falling ill after eating apparently contaminated food was potentially a matter of national security threat?
No, I can answer that because I've answered it many times before.
Okay. The second,
at the time NATJOINTS took this decision, we did not know what was happening. It was just reported that all over the country, children are sick, they are being rushed to court. That's enough to cause national security threat. And that's why NATJOINTS said this work need to be coordinated, as we are coordinated now, and you can see the results.
The last one, can you provide an update on government's efforts to investigate other food-related illness among school children in other locations, not only in Naledi?
Well, maybe it's important for us to explain this. As far as we are concerned, there's no evidence to link this with the school nutrition program all over the country. We have completely excluded it, maybe until we find evidence. At the moment, we don't have it. All the kids who got sick at school did not eat from the nutritional program of the school. They go out of the gate and buy something from hawkers. As we told you, our biggest fear is that we had that this organophosphate, which in Sepedi is called ralipirime, is actually being sold by hawkers. But the school nutrition program has not caused any of the problems. Until we gather further evidence, it will remain so. If we get any more evidence about that, we'll inform you.
Thank you very much. Any
just one addition.
Yes.
On the side of caution, one of these days I saw, I think it was a principal in Mpumalanga, actually warning parents, cautioning them rather, to say, let us discourage children from doing exactly what Dr. Motsoaledi is talking about. It rather goes to parents to warn their children, don't go outside the gate, buy whatever, particularly at this point in time, was going to cause us a lot of trouble. I mean, take this opportunity once more that on our behalf, on behalf of all of us, we do want to sympathize with families who have lost children and those who have gone to hospital, and all of them. We are doing all what we are doing to actually be on the safer side as soon as possible, but our sympathies to them. Thank you.
Thank you very much. Any last comment, input, statement from the Minister of Small Business and Development?
Thank you so much, Program Director, and greetings to all. Probably on the business side of the matters that you've just spoken about was this continued reference to spaza shops and now hawkers. You may be wondering what is it that government is doing in order to make sure that those that may be found on the wrong. And this is why we said there's a need for us to work with other departments in terms of raising awareness on matters like this, because spaza shops source food from distributors and food manufacturers. whether it's hawkers or whoever, they don't produce the food. Of course, it is different when they are found to have a product that they have bought and in their space, which requires raising awareness on the things that they can buy and those that they can't buy. Those that they have to buy and require certain compliance measures, they have to be compliant. And this is why we are working with the different departments and the municipalities, including the National Consumer Commission, to raise awareness to our own constituency. We have set up the Township Economy Task Force that is made of food manufacturers themselves, because they are the ones that have distributors in the different provinces and municipalities. So we brought them on board, the Consumer Goods Council of South Africa, the National Consumer Council, and the relevant departments to say, all of us must play our part. You've got to give a certainty and assurance that the food that you are supplying to our constituents, and in this context, the spaza shops meets the standards. Of course, we are aware that there are those that are manufacturing illegally, and this is something, again, that we have said as government, we're joining hands with the respective department, whether you talk about Home Affairs or the Department of Employment and Labor, the district municipalities and health for environmental inspections. And this is what we're trying to do to minimize the escalation of the challenges that we may encounter as we move forward. It's not something that we established because there's this recent incidents. It has been ongoing. We set up the team last year. In October, they've had their different meetings. They are finalizing certain things because these matters are legislated, which is why the task force agreed that there's a need for us to therefore go directly and work with the municipalities that are concerned to assist spaza shops with registrations, because it is important that they be registered so that we can know in a particular street there are so many spaza shops and who's running them. We're working with the ward councillors, with the CDWs, including the wholesale and retail SETA, which has just sponsored appointment of 200 unemployed graduates to complement the existing personnel at the local level, because we are appreciative of the challenges that the municipalities face as they are supposed to be doing this work. So we're doing this in order to beef up capacity of government, to make sure that we address the matters holistically, whilst others are looking at the health aspect, at the criminal aspect, but there's also that aspect that requires the citizens themselves and the communities to be the voice of their own children by raising these matters with the respective authorities, including highlighting the wrongs that they see. When you have rented space out to a person for living, the person shouldn't be producing food unless it's food to be eaten at home. But if it's for commercial purposes, it means there's something wrong that you are doing, whether that person is a South African or a non-South African, which is a matter that is clearly stipulated again. If you look at what is it that South Africans can do to assist legal foreigners that are trading in South Africa, and what is that they cannot do. And all of us, colleagues, I think it is important that we try to raise that caution to say we should really think about the actions that we are taking, not that we are not aware that people must make profit, but there's lives that we must always consider, because it may not be your child, it may not be you today, but it can be a grandchild if you're not thinking about the communities that you are selling to. So we've called upon all those that are involved in terms of our constituency to say they must exercise caution when it comes to this, but we continue to raise awareness with the respective bodies. Let me pause there.
Yeah, I was asking Foster if he has distributed this speech I was reading here. I want to appeal to journalists who have read it. There's a terrible, terrible mistake there in the last paragraph. I'm just noticing it now. We wish to advise that if faced with a possible organophosphate poisoning, doctors need to use, it's supposed to be aflatox. That is the herb, but it's written aflatoxin there. Yes. Now, aflatoxin is a very dangerous chemical, which is a carcinogen. It's found in molds. I think the person who was preparing the speech, when I said aflatox, he went to Google aflatoxin, and Google must say, please cancel it. It's aflatox, because it says people must use aflatoxin, meaning we are asking people to use a poison. Yes, it's AfriTalks. AfriTalks is an app that will tell them what to do when they see the symptoms. It will tell them what they are likely to do. It will also give them the dosage of atropine, how they titrate it in the human being per body weight, etc. So it's AfriTalks, AFRITOX, not AfriTalks. Please. Thank you very much.
Thank you, Minister, for that clarity. Members of the media and fellow colleagues and members of the panel, I'm going to officially declare, I'm not going to take the second round precisely because some of the members of the panel here, it's exactly 10:15, they're supposed to be boarding an international flight. In fact, they're late, so, but we will see how for them to ensure that they don't miss that flight. So we apologize for this, but we'll continue to engage with you outside this formal media briefing. So we've got all the experts and other leaders who are here. We'll continue to engage with you to clarify this matter going forward. On that note, I'm going to officially adjourn this media briefing under the guidance of our political principals.
Yes.
Thank you.
Thank you. Anybody who wants